Hello, this is Dr. Drew Hall with Upper Cervical Healthcare of Los Angeles and Carson. Today what we want to talk about is kids and upper cervical chiropractic. There's a lot of misconceptions out there in the public. Generally, people have been trained to think that we should only seek healthcare when we have diseases, syndromes, and symptoms. But before a disease process rears its head as symptoms, there's something going on inside the body, something's malfunctioning prior to the onset of symptoms. But our traditional healthcare system has taught us to wait until we're sick, and then once we're sick, go seek out help. And then our way of dealing with these types of health problems generally is to throw medications at them, and if it's severe enough, to do surgery. So in upper cervical care, we would like to get to the problem before it becomes a symptomatic or disease problem. And so just a little bit about upper cervical care. Basically in our office, what we do is we are focused on the central nervous system. We know that the central nervous system, which includes the brain stem, and the spinal cord running down through the spine, and then the network of nerves that come out of the spine that then feed the rest of the body, are responsible for controlling everything. And so if the nervous system is responsible for controlling everything, if there's an interference to it, we want to correct it before it becomes symptomatic and before it grows into a long-term chronic health condition. And the best time to address spinal problems is when they first happen. Now, getting back to kids and pediatric upper cervical care. When kids are born, the birth process is naturally and inherently a difficult process, even if it happens naturally. Sometimes kids get stuck in the birth canal and they need forceps. Sometimes they use a vacuum extraction. Both of these procedures produce an extreme amount of force to the head and neck junction as they're pulling the kid out. And because the head weighs 10 to 12 pounds on an adult and a 2 ounces bone it sits on called the atlas, the head neck junction is a very vulnerable area, especially in a newborn. So when a child is delivered, that's the first time that they should be checked for an upper neck misalignment. If there hasn't been an injury that occurred, let's fix it before it becomes a big long-term problem. And then we have kids learn to walk. The average kid that learns to walk falls down 2,500 times. Any of you have had kids can vouch for this. Kids fall down, hit their head on concrete floors. They run at pools and slip and fall on the deck and hit their head on the pool. And there's all sorts of things that happen as we grow up, falling out of tree forts, falling out of swings, falling upside down off of the monkey bars, all these things I see in my office. And again, instead of waiting, if a trauma has happened and that top vertebra under the neck is locked and created nerve pressure, instead of waiting till symptoms express themselves, let's correct that structural problem so it never happens in the first place. And so largely in our office, because the way we've been educated in healthcare in this country, we see people with chronic health problems who have been everywhere else, and we're the last ditch effort. This video is to try and educate anyone who listens to it that we should be doing things that are good for our body, whether that's eating right, exercise, sleeping, keeping your upper neck clear of the cord so your nervous system can function as best as it could, our whole life, not when we just have a crisis, right? So we like to promote in our office that upper cervical care should be from birth till death. Yes, we help people with all sorts of chronic conditions, but upper cervical is really about promoting function and health in the body. And so regardless of whether you feel good or you feel bad, you should come in to an upper cervical healthcare office, get your upper neck checked to determine whether you have one of the upper neck vertebrae locked out of position and impacting your spinal cord, so we can correct it and help you be as good as you can be. So our office, we have an office in Carson which serves the Long Beach, Redondo Beach, Rancho Palos Verdes, Cerritos, all the surrounding cities, and then another office up in Los Angeles that serves Hollywood, Westwood, Los Angeles proper itself, Burbank, and all the surrounding cities. If you're outside the Los Angeles area and you're interested in upper cervical care, you can call our office at 310-324-6172, and we'd be happy to find you an upper cervical chiropractic office somewhere in the country that's close to you. And again, we offer free consult exam in the office, whether you're 1 day old or 105 days old, to determine whether you have an upper neck injury that's impacting your health and whether we can help you. So thanks for listening. Hope this was helpful and educational.